Hi, thanks for joining our session. This is a group of individuals from Shepherd Center and Can Do talking about a partnership that we've had that has greatly benefited the population that we serve, and that population is patients with multiple sclerosis. Today, we actually have three great panelists here to talk about this. And what we're going to do is we're going to go through them one by one, and they're going to give you a brief introduction. We're going to start with Dr. Ben Thrower with the Shepherd Center. He's going to not only introduce himself, but talk about the partnership in general. And with that, Dr. Thrower.
Great. Thanks, Chet. And thanks, everyone, for joining our session. So I am Dr. Ben Thrower. I am a neurologist, and I am the medical director of the Andrew C. Carlos MS Institute at Shepherd Center in Atlanta, Georgia. We take care of nearly 3,000 individuals with multiple sclerosis here at our MS Institute. And one of the things that I learned early in my MS career is that doing multiple sclerosis care appropriately it truly takes a team approach. And so it's much more than just a neurologist or a nurse practitioner or a physician assistant. It really is this comprehensive integrated approach involving physical therapy, occupational therapy, speech language pathology, neuropsychology, case managers, just this amazing comprehensive team. And that team has to be integrated. One of the areas that has really gotten a lot of attention in recent years is the importance of wellness and exercise in multiple sclerosis. And as we are here today, that sounds like it would just be such an obvious statement that exercise, wellness, those are important concepts in MS. But it wasn't that many years ago that was not accepted. Into the 1970s and 1980s, people with MS were actually told not to exercise. And so they were told this for fear that they would worsen their underlying MS. They would use up what little energy they had. So you get an MS diagnosis, you're a young, healthy adult, and you're told go home and sit on the couch and don't do anything. Fortunately, now we know that that is incorrect. And one of the ways that we know that that is incorrect is through a group called Can Do MS. The folks at Can Do MS and with their founder, Jimmy Huga, really spearheaded the challenge to that notion that exercise was bad in MS. And so as I was getting into the MS arena, I spent a lot of time with the Can Do staff early on, and they were pivotal in forming the way I think about managing multiple sclerosis. So over the years, as I spent time as medical director here at the Shepherd Center, I really realized that it would be so wonderful to bring those two wonderful organizations together, to re-engage with Can Do, to see that how we could partner to best serve the MS community.
Thank you, Dr. Thrower. I'm going to move on to our next panelist, Ms. Christine Warner.
Hi, thank you so much for having me. I really appreciate the time. I'm Christine Warner. I am a patient of Dr. Thrower's at Shepherd Center. Dr. Thrower diagnosed me with MS in 2012. And the notion of exercise with MS is particularly important to me as a former college athlete and being an athlete my entire life. So it was particularly devastating when I started not to being able to perform athletically like I used to. But I do serve as secretary of the Board of Trustees now at the National MS Society. I chair our Government Relations Advisory Committee. I have participated in the 2-day Can Do MS program at Shepherd, as well as the 4-day Can Do MS program at Shepherd. I also participated in Can Do 2, Continuing the Connection, in 2019, which was a virtual program that Can Do started. So thank you for having me.
Thank you. And finally, we have Mr. Brian Thompson with Can Do.
All right. Thank you, Chet, and thank you, Dr. Thrower and Christine, and thank you, Health Connect South, for having us. My name is Brian Thompson, and I am the Director of Programs and Compliance for Can Do Multiple Sclerosis. And as Dr. Thrower alluded to, we were founded in the early 80s by a ski racer named Jimmy Huga, who's an Olympic champion. and was diagnosed in 1970 at the age of 27 with MS. And he was told not to exercise. And after a few years of following doctor's orders, he branched out on his own and brought together a team of experts and really developed an exercise plan that worked for him, and a plan to really address his health and his wellness along with his MS in his overall care. And as his quality of life increased, Jimmy thought that maybe others could benefit from that approach and to really rediscover what you can do with this disease. So he started bringing people together from all over the country to share strategies and share ideas. And we've been doing that for over 30 years now. But a lot of that education, we call that the can-do approach, and it was sort of insulated in our organization. And so our entire approach really was enhanced in a few years ago, 2017, when we started doing programs at the Shepherd Center and utilizing their incredible facility there in Atlanta. And their team that we found was really aligned with our values and our approach to supporting families living with MS. So since then, we've done more programs together, and our partnership has really grown in synergy and in strength. And now we're sort of intertwined as we travel down this road together. So so happy to be working with Shepherd and happy to be here.
Thank you, Brian. Great introduction. And I am Chet Basine. I'm the Chief Strategy Officer here at Shepherd Center in Atlanta, Georgia, in the Buckhead community. I've been with the organization about 4 years. My first 2 years, I was the Chief Operating Officer, and then was promoted into the Chief Strategy Officer role a little less than 2 years ago. Shepherd Center, we do have a very robust multiple sclerosis program here, as you've already heard, and you'll hear some more. But beyond the multiple sclerosis piece, we also really are known for our spinal cord injury. That's actually what started us. Mr. James Shepherd, his story is he suffered a traumatic spinal cord injury while surfing in Brazil 45 some years ago, and then that inspired the family to open up the institution, which has grown significantly in its 45 years. We not only do spinal cord injury, we also do brain injury rehab, which includes stroke. Most of our patients actually originate from outside of the state of Georgia, which is a little known fact. And our reach is definitely, if not national, it is semi-national. So what I'm trying to tell you is our patients come from well outside of Atlanta, and we do occasionally admit from international as well. It really is the clinical thrust that brings patients here. So with that, what we'll do is we're going to move into our first question, and that's for you, Brian.
Great.
And what I'd like you to expand upon is what has been a good outcome that has come out of this partnership that was not anticipated?
Yeah, it's a great question. And actually, I've got three for you. One is sustained synergy between the organizations. We started off, as Christine mentioned, we do a 4-day really intensive program called Can Do, where we bring people together for 4 days to learn about health and wellness and try to solve problems together and come together as a community. We do a 2-day program. We do a 1-day program. So what started off as coming together for a 4-day program has really blossomed into a full partnership well beyond that. Dr. Thrower is on our board of directors, and several members of the Shepherd staff continue to contribute to our programs beyond sort of the base of what we came together to work on. And in doing so, our programs and our assets have been infused with new energy and new perspectives, which has been really important to us. We're a centralized nonprofit based in beautiful Vail, Colorado, where Jimmy was a ski racer and started. So to get those new perspectives and help us see our blind spot has really helped us strengthen as an organization. The second has been just better outcomes from our programs. To be able to utilize the Shepherd facility and the Shepherd staff has enhanced the quality of our program, and we're seeing that in quantifiable improvements in outcomes. So that was certainly a nice outcome to see. And then finally, just sustained relationships with our participants. Shepherd has really allowed us to stay in touch with people like Christine and the other Shepherd patients, and to be able to follow them through. So it's not just a 10-1 program and then they go home, but we can continue that connection. And simultaneously, the Can Do program has brought new families to the Shepherd Center and created some new patients for them. We had one participant in particular who moved from San Francisco to Atlanta just because she loved Dr. Thrower so much and she loved the Shepherd Center. So that was another great outcome of the partnership so far.
All great answers. Thank you so much, Brian. And Dr. Thrower, how would you like to expand upon that?
Yeah, I have absolutely loved this relationship. And again, my sort of work with Can Do goes way back into my early MS career, and this is just taking it to that next level. And I also have three areas that I think we have really benefited from. I think one would be our Shepherd rehab staff have benefited from working with the Can Do staff. Some of the Can Do team has worked together, closely for 30 years, as Brian said. So these are very seasoned, very knowledgeable, very well published, healthcare providers from a wide range of specialties, and they come from all over the country. Some from outside of the country. So they all bring this really unique perspective. We've got our young staff here of therapists, so they get to come in. Our young staff work with these very seasoned individuals and really benefit from that knowledge. I think from the standpoint of the Can Do staff, a lot of those individuals have been at their institutions for a long period of time. And that's good on one hand, but it's nice sometimes to bring them to a facility like ours. So now they're seeing these young staff and they're seeing, oh, there are different ways of doing things. Here's another type of facility, that is really striving to be world-class in its comprehensive integrated care. And so there is this great exchange of information that goes back and forth. So I think both staffs benefit from the exposure to one another, and ultimately the people I think who benefit the most are the individual participants and their support partners. That's what it's all about at the end of the day. So these individuals are, I wish we could offer this program to everybody with MS in the country. Unfortunately, we can only take in about 25 individuals and their support partner per 4-day program that we do. Can Do is doing a wonderful job of trying to do other virtual programs, any number of other offerings. But for the actual sort of the 4-day program, it's a small select group of people, and I just wish everyone could experience that. When you feel the energy in the room, and then at the end of the program, you listen to the individuals with MS and their support partners as to what those 4 days meant to them. It is truly life-changing for these individuals. And not to be cliche-ish, but I really do believe that the healthcare providers who work in those 4-day programs, who provide those services, get just as much out of it, not just from the exchange of professional information, but from giving to those individuals and getting back just that sense of, wow, I've really done something to change someone's life over these 4 days.
Great. All good points, Dr. Thrower. Christine?
So, yeah, I can echo everything that Brian and Dr. Thrower said, but of course, from the patient perspective, it was really interesting for me. So being a patient at Shepherd for a few years, I already understood and knew Dr. Thrower's model of the patient being at the center of care and having a team around me. And having been through a few relapses and needing a team, needing OT, needing PT, needing speech, needing neuropsychology, and needing all of those things sometimes all at once. But I got to see people coming from areas of the country and look in awe at our program and say, I can't believe that this is where you go for your MS. You have all of this here, and you can come here every day and go to a wellness program for MS. You realize how lucky you are that you actually have this luxury. And at the end, one of the things I realized is that I didn't want to take that for granted. And the other thing is, because I had been seeing Shepherd therapists and doctors for the few years, I actually got exposure to a different physical therapist and a different occupational therapist and a different, psychologist and a different dietitian. And so I could see, oh, are these things matching up? The physical therapist actually got to sit with my physical therapist at Shepherd and evaluate me together. And he had thought of an idea for my gait, that she hadn't thought of. And so that was really exciting. So just as a patient, my therapist and other care providers were exchanging about me. The other thing, I think the partnership has empowered patients that don't have care like this to go back to their communities and start either looking for it, trying to identify that type of care, or start demanding it. Start, looking at Shepherd as a model and saying, why can't we have this here? We should have this here, where I should have a team, here, and at least know that if you can't have it all in one place, you should be asking for referrals, to OT and PT, and all of these things are necessary to take care of your illness. So the education is really important. But I think the biggest thing for me was seeing the support partner piece. And I'm trying not to get emotional, but my mother came with me to the 4-day program. I had MS at that point for 6 years. And afterwards, she said to my sister, I finally realized that Christine has MS after being there with me for those 4 days.
Wow.
So.
Wow, that's very insightful, especially coming from a patient. So thank you. I can tell you, just having not gone to the 4-day event as a patient or a caregiver, as an employee of Shepherd Center, the energy. I think Brian was talking about that. That is very much in your face as soon as you, in a good way, in a wonderful way, as soon as you walk in the room. I distinctively recall speaking with a patient's care partner, and the partner was telling me that normally 7, maybe 7:30 at night, this individual would be zonked out in bed because MS makes you very tired. And this specific patient was up till 9 or 9:30 every night, having the time of their life with others in the program, at the hotel, and it was just such energy and I remember the caregiver telling me that this won't happen anywhere else. So yes, a lot of truth there, and yeah, we are fortunate to provide the patient all the resources from therapy, clinic, infusion, MRI, life skills, whatever it is all here under one roof. So I'm glad, Christine, you're able to expand upon that for us. So with that, I was going to move us on to our next question that we can help talk about, and that is, what was a learning lesson or challenging event that made this partnership better? And I'm going to start with you, Christine, on that one.
So, yeah, this was a nice segue, talking about the connections that we make. So, and the 2-day program as well as the 4-day program, they are long days, and we start very early, and we go into the evening. And when you spend a lot of time, with the people, you make close connections. And I think what was challenging for us was at the end, that we had to leave. And, I do live here in Atlanta, but most of the people I met, if not all the people I met, did not. They lived in New Jersey. They lived out west. They lived in Florida or the Carolinas. And, we were a little sad because it is a unique community, and it is exciting, and you feel a sense of relief when you get around a group of people where you don't have to explain. You can start a sentence and then the rest of the people go, oh yeah, I get it. And then you're like, oh, you're not the only one. And so you become very close quickly. And so I did start a Facebook page for the Shepherd participants. And then someone else started one for the support partners, because our needs are very different. But the good news is Can-Do realized we needed more than that because we were missing each other. And that's when they did Can-Do, continuing the connection to follow up with us so we could meet in smaller groups every few weeks to see how we were doing and talk about our challenges, talk about our wins, talk about how we were doing since we met and following through on the goals that we made. And if not, what were our barriers? And we were also excited to get connected again. And ironically, this was pre-COVID. So it kind of got us in that virtual mode, kind of just in time. So that was a great thing.
Great. Excellent. Dr. Thrower, what do you have to say about the challenges?
So it was interesting early on with this, with the marriage, if you will, of the two organizations. Both organizations have, a distinct culture. There's a lot of pride in the way we do things, and so bringing those two cultures together, there was also, I wouldn't say there was friction. There was just sometimes resistance to say, well, I'm not so sure about this. I know we do things right. I'm not so sure about those other guys. And so there was a little bit of trepidation at first until everyone realized that, no, we all have the same goal, the common goal of doing what's right for the individual with MS and their support partner. Logistically, it was interesting. I was blessed to be able to sit back during that first Can-Do Shepherd 4-day program and watch as all of the very accomplished staff at both organizations were able to work out those logistics. Typically, the 4-day Can-Do programs are done in a nice hotel setting. So you've got a restaurant, you've got catering, you've got all these food services there. Now we're moving this into a hospital setting. Yes, Shepherd has a wonderful food service, but we're not used to necessarily taking care of a large convention type setting for 4 continuous days in a row, and doing it at a world-class level. And so it was amazing to watch both staffs come together and work out those logistics, to watch them, figure out how all of these things happen room-wise. With COVID, as Christine mentioned, I mean, we have new challenges that were put in place. Our last program in May was a virtual program, and to see Brian and his staff pull off a virtual 4-day program, it was just amazing how well it worked to be able to, because we realized you're sending 25 individuals with MS, 25 support partners to different meetings. Sometimes they're together, sometimes they're separate. So, Mrs. Smith is meeting with a physical therapist while Mr. Smith, her husband, is meeting with a counselor or somewhere, and have that all happen virtually where you're all in one room at one point and someone clicks a magic button and poof, everyone goes back to their room, and then poof, we're all back together. I was blown away at how well that actually worked. So, there were definitely challenges early on, but I think if the two organizations, regardless of what population they're serving, if they have that common goal of serving the patient well and doing that right, I think that you can overcome those challenges.
Great. Thank you, Dr. Thrower. And Brian, what do you have to offer us?
Yeah, piggyback on what Dr. Thrower said. I think for Can-Do MS, our perspective, the biggest challenge was many of our original founding fathers and founding mothers of the organization are still involved. And so they are very protective and entrenched in this Can-Do approach that they helped create. And so there was some fear because we've always kind of done things our own way. So by partnering, is that going to change what they've invested, for decades in? And there was no precedent for us to partner like this before. So it took some assuaging and some politicking and some really open communication with Shepherd. But ultimately, as Dr. Thrower said, after that first program, we realized that the values and the approach and the culture was so aligned. And ultimately, we're all here for the same goal, and that's to provide the most comprehensive, impactful experience to help families living with MS. So a good outcome came from Can-Do MS's perspective, because it was a total paradigm shift of how we've done things for decades. A second challenge, partnerships are made out of people, and people need to come together to plant that seed, and then things grow. So for us, our director of programs, who helped really start this program and this partnership, left in May. And so for us, it was from a big picture perspective, is how do you create a sustainable partnership when you take that person out of the equation? Is that sustainability still there, and not just depending on one person to steer the ship. So that's something that we've had to adapt to, along with as Christine and Dr. Thrower mentioned, COVID was a huge challenge for us, and to adapt that program when Shepherd, the facilities are so crucial for the program in the last few years, and just the energy and everything that you were talking about, Chet, about people having their time of their lives and coming together and just having that time together. How do you recreate that on Zoom or on an online program? So it really forced us to adapt quickly, and we couldn't have done it without that energy and that investment by the Shepherd staff. And their perspectives on telehealth will continue to help us as we evolve into this virtual new world that we have. But how do we still create that energy, that impact, and that community? That was a big challenge. But I think we were on the right track, and we still got great outcomes from the program. The staff was fantastic, and another challenge was just practically, the great PTs, physical therapists at Shepherd. How do you do an assessment when you don't have all that great equipment at Shepherd and you're doing it over a webcam? How do you adapt to that? And we couldn't have done that without Shepherd's involvement with telehealth and their experience with that.
Great. Well, thank you. Yeah, the energy, I know I'm going to repeat myself, was outstanding. I think to me it rivals a wedding that someone's looking forward to going to for months, and then they're finally there. And then at the end, you're like, oh my God, it's over. It went by so fast, but it's that is the energy I felt when I was there. What I want to do is ask the next question, and that, Dr. Thrower, you'll be the first one to answer it. That'll be, what advice do you have for other healthcare providers looking to partner with advocacy groups towards advancing care?
So early on, when I was at the first MS Center, before I came to Shepherd many years ago, I was at Holy Family MS Center. We set that up in Spokane, Washington, and the challenge we had there was a lot fewer resources than what we were blessed with at Shepherd Center. And so one of the things that I learned early on is in working with other groups, whether it's a pharmaceutical company, another nonprofit, is look at all of the stakeholders that are in your sphere, and what is it that they want? What are the resources that they bring to the table, and where are the commonalities? Where do your goals align, and where can you help each other out? And so with Can Do, it was just such a natural. We have the way I think about managing MS was largely formed by the Can Do model. So that was a natural, and it just, because both organizations really have this goal of improving wellness, improving the lives of people with MS, and both have these wonderful staffs of people to help do that, it was just a natural. I think it's really important to put egos aside and to say, ultimately, it's not about me and you. It's about people like Christine. It's about, if we're doing what we're supposed to do, we're supposed to be serving a certain patient population and their support partners. And so put those egos aside, learn where you can learn, but have open and honest, conversations as well.
Great. Thank you so much, Dr. Thrower. And Christine, what do you have to offer?
So, yeah, it's interesting coming from my perspective. I did work for a long time before my diagnosis in IT. So being through a lot of mergers, acquisitions, and partnerships, it's always interesting to see how they go. So, of course, the alignment of values, like Dr. Thrower says, is important, and definitely putting egos aside is important. But now what I do in my role at the society, serving on the board and also serving in advocacy, I'm so fortunate to meet patients and care providers and families from across the country and sometimes from other parts of the world. and I'm always talking about Shepherd, and I'm always talking about Can Do. And a lot of people are just like fascinated by both. And to me, they're one and the same. But for example, I met a neurologist when I was in Washington, D.C. At the public policy conference. And I was telling her about both. And she says, you know, I am wanting to open an MS center where I am in Virginia. And I said, well, come visit Shepherd. Dr. Thrower, I know, would love to have you come visit. And she goes, yes, I will. And so that would be my advice, would be, if you're really serious about a partnership, like go see Can Do, go see Shepherd. Now, when I say see right now, it may not be in person, but, you know, to be able to see us in action, see our program in action, their programming in action. They have a lot of virtual programming right now, like, you know, sit in on a few, see how they are. Talk to like Anna Berry at Shepherd. She was instrumental in the partnership. Dr. Deb Backus, who is our head of research, she was also instrumental. You know, talk to us about our patient outcomes. You know, Shepherd is very good at not only initiating the research, but also doing follow-ups on the research. So I've been followed up a few times since I went to Can Do on several different tests, you know, to see, you know, my progress. So we have great outcomes reporting also. Also talk with Dr. Thrower, you know, about our patient-centric model, because I don't really believe there's another way that it could be done because of the way Can Do models their programming. I think it would best be done if healthcare providers also have the same mindset, like Dr. Thrower was saying. So I think the providers and groups could all learn from each other. But my advice would be, like, just go and see for yourself and talk to patients. You know, you can always talk to me.
Absolutely, yeah. Go. It's that's who we're treating. So you're spot on. I think it's an awesome answer. Brian, what would you like to share?
Yeah, agree with everything that's been said, but I think for us, it was really important to build the foundation of our partnership with the who and the why, and then the what and the how kind of came from there. But when we started this partnership 5 years ago, our CEO and our board chairman of the board flew out to Atlanta, and Dr. Thrower and his team just took them out in Atlanta. I think they dressed up like pirates. I've seen of that.
That was key. That was very important.
And we just got to know each other as people, and we realized that we really respect each other and like each other and inspired by each other. And I think that was the base level that grew from there. So making sure those values are aligned and just personalities that they align. From there, to piggyback on what Dr. Thrower said, is one advice is make sure you have a clear plan on separating sort of the big picture strategy and the relationship management from the logistics. Because I think it's really easy to get bogged down by that how piece. And so planning ahead of time how to kind of separate those so we're not getting bogged down and we keep the eye on the prize. But also having that communication aligned, which is much easier said than done. But I think that's something that we've learned with logistics is how do we not get bogged down with that, but still be cohesive. And then finally, just being flexible with changes in our organizations and in our visions as they evolve, the healthcare landscape, obviously, and just the patient engagement cycle, and how to really be flexible, but staying united in the vision. So,
Excellent. Yeah, and my opinion on this is really the organization's cultures have to be aligned, which there's clearly a harmonious sync here between Can Do and Shepherd, no doubt about that. And really us as healthcare providers, whether you're a hospital or a clinic, your fundamental goal is to improve the health in the communities in which you serve. For us, it's with MS, we took a approach of we want to treat everybody, and given the resources and the reputation, we're able to treat folks not just in Atlanta but outside of Atlanta, as evidenced earlier with the relocation. But with this partnership, it actually allows us to improve MS education and awareness around the country, because the majority, as you've heard earlier, the patients actually for the Can Do programs come to Atlanta from out of Atlanta. So it allows us to actually import this information into communities that might not be there yet. So that's kind of our level of advancement of MS in terms of improving the knowledge and improving those communities. So definitely on board with everything what y'all have said. Well, I'm here to our final question, and Brian, I'm going to tee it up with you. And what is on the horizon for this partnership between our two organizations?
Yeah, like the synergy just continues to evolve. So in a few weeks, we're doing a virtual multi-day program for young adults, 18 to 40, which is certainly an unmet need in the MS community. And several of the Shepherd staff are involved in creating that and working one-on-one with our young adult participants. So that continues to evolve. As Christine mentioned, with outcomes, that's really important and something that with Dr. Backus that we've really become more sophisticated in. And now the next question is, how do we adapt that to a virtual evolution? So we're continuing to work on that. And then lastly, our value proposition has evolved into really looking at lifelong support. So we want to be engaged with our participants and people with MS, not just for one program, but for an entire lifetime. Which is also Shepherd's model and what they do so well. So there's lots of ways to integrate that, and hopefully we can continue to bring new patients to Shepherd, and Shepherd continues to bring participants to us and enhance our experience. So things are going to look a little different, especially in this virtual world, but hopefully we get back to doing in-person programs at Shepherd Center and really ingraining the communities as we evolve. So,
Thank you so much, Brian. And Dr. Thrower, how would you like to expand on that?
Yeah, I think one of the challenges and opportunities for both Shepherd and for Can Do as we go forward is, at our core, I think the healthcare providers that at Shepherd and Can Do, we know we're doing a good thing. We feel it in our guts. How do you prove it? How do you put numbers to it? And so this goes back to what Christine and Brian were saying with outcomes. So when I started at Shepherd, one of the things that I realized very quickly, I knew MS, but I'd really never been exposed to a world-class spinal cord injury program. And it became so glaringly obvious that in spinal cord injury, those folks had great outcomes. They could say, well, Shepherd Center can compare outcome X to Craig Rehab or to Chicago, to any other, and really give a grade, a very objective grade. The challenge with multiple sclerosis is our disease state that we work with is so variable from individual to individual that no one really even agrees upon what the outcomes are. So that was the first challenge for people like Dr. Backus at Shepherd, to figure out what should we be measuring. And now let's put the rubber to the road. How do we show that what we're doing in our 4-day programs and the other programs we can do, what we're doing at Shepherd through our wellness and rehab programs, how do we know we're doing a good thing? And how does our program compare to a program in, say, in California? And I think ultimately for all of us, those things are vitally important if we hope to someday get better third-party, payer coverage for some of these services. I think the services that Can Do for decades has offered to people with MS is so valuable, but insurance doesn't pay for it. And there are a variety of ways that the individuals get there through donors and fundraisers that Can Do does. But it would be wonderful to see a day on the horizon when we get third-party payers to see the value in this and say, you know what, this is a health program just as much as me starting a biologic agent for a person with MS. This is vital to their long-term health.
Very, very true. Great points there, Dr. Thrower. And Christine, curious to your thoughts.
So I I continue to encourage everybody that I meet that has MS, or if I meet a family member or support partner with MS, to check out, Can Do programming. If I happen to get their contact information, if they are willing to give it to me, I immediately start sending them programming. And when I went to Montana on a kayaking trip for MS patients with first descents, I think I pretty much got almost everybody there to sign up for some sort of Can Do program, whether it was virtual or applied for like the 4-day one at Shepherd, because they heard me talk so much about Shepherd, they all wanted to come. And in fact, one of the girls I met there, Kim, who is from New York, wound up being in the virtual one that Dr. Thurr was doing. And she's like, I'm with your doctor right now at a Can Do program. So it's just really such a small MS world. And so the biggest thing, and I said this before, is I can't thank Can Do enough for what they do for the support partners, because I think for so long, the support partners and other family members were so underserved. I mean, there was so much programming and education, and it was great for what is MS, what are the symptoms, or what are the DMTs and what do they do, or what's a relapse, and all of that stuff. But for family members or support partners, to how do I cope, how do I deal, how do I still be a spouse but not turn into a healthcare provider for my spouse at the same time? How do we maintain our relationship, and for them to have an outlet to speak freely about that with other people going through the same thing is so valuable. And I just saw so many relationships change and light bulbs go off between people who had even been dealing with the illness, for 20 or 30 years. And it just gave the younger couples and the group, a lot of hope. So I just think that's such an important part. And I hope that Can Do can always do what they do for us with MS, because I think it's just very valuable, and I feel very blessed to be a part of it and a part of Shepherd.
Thank you, Christine.
Thank you.
Yeah, excellent reply. We do have a couple minutes, so what I can open it up to is if there's any final thoughts or something you want the audience to know, in no particular order. Please let us know what's on your mind.
Again, I would just go back to the, whatever, I don't care if listeners are working with diabetes, hypertension, Parkinson's, whatever the health state that you're working with, just again, keep that patient-centric model in mind. And I've been a neurologist for 30 years now and it just, to me, it seems like the more you step back and focus on that, things seem to take care of themselves a lot of times. We're all living through some very challenging times. Now with COVID, we're always in challenging times with, different changes in the health system in the United States. But it seems like if you go back to that model, things usually have a way of working out.
Well said, Dr. Thrower. Well, Brian and Christine, if you don't have anything, or if you do, we'll final call. If otherwise, we will wrap up here. Is there anything you'd like to share?
Yeah, just thank you again to Health Connect South for recognizing this partnership, and for listening to us today. Hopefully inspires and gives you some ideas how to take these partnerships. It's really a lesson in that together we can achieve more, and it takes some work and some investment and some compromise, but ultimately both the joint goals and the individual goals are enhanced through partnerships like this.
Thank you. All right. Well, I want to say thank you for your time. We have all enjoyed sharing our knowledge with you, and we do hope that the rest of your day goes as very smooth. Thank you so much. Bye.
Thank you, everyone. Thanks, Chet.
Bye.
Thanks, Chet.
Thank you.